number one, want to say that this is going to be a little bit different perspective. I like to say that 99% of your health care is outside of your doctor's office, but that's not what we're taught, and that's not how we're kind of trained as people, certainly in the United States. We think we get a pill or we get referred to a specialist, and that's what health is all about, and that's how you stay healthy. I like to ask you to think about something. You know, when we start out working, you know, we start out in our 20s or 30s, and hopefully we work for 25 or 30 years, and you are, whether it's a small business, a large business, you go into business for yourself or someone else, and hopefully over those 25 or 30 years, you do some really cool things, whether it's business or family, you build some financial security, and then you get into your mid-50s, I'm 57, and if you look statistically, actuarially, if you make it into your mid-50s, the likelihood is you're going to make it into your mid-80s. So the question is, do you feel like you can go to your mid-80s? I think I do. I feel great, and I practice all the things we're going to talk about. This is meant to be interactive. We will actually have times when we're going to be kind of separating out specifically at the end of this. You're going to hear me talk for about 45 minutes. I encourage you to ask questions, whether they're questions that you have personally, whether your friend asked you to ask something, whether it's something you read about in the newspaper on a news feed. I really don't care. So I am willing to go wherever you want to go. Do I need this mic?
No. I'm just talking to general direction.
Okay. I'm not going to disagree with many.
I may not even, it should be, I'll get there and see.
So,
is that better?
Yeah.
Yes.
All right. So, I encourage you to ask whatever questions you have. We'll get toward the end of it, and we'll actually have a time to kind of really think about what we've learned in the last 45 minutes and make a plan for the next week that you're going to actually try and implement. And it'll build on the next couple of weeks because we're going to do this for 3 weeks. So I encourage you to first kind of think about, you've all come here for different reasons, maybe just for general information, maybe you have a specific issue that you're thinking about or challenged with. Take the time right now, just take a couple minutes. You're not going to have to share it with anybody, but write down on your notes, which you have in front of you, what are the things that you want to try and get out of this personally? What are you struggling with? What do you really want to make different about what your life and your health is doing right now? And just write them down. We'll take a minute to do that. Anybody need a pen?
I have some pens.
You need a pen?
Anyone need a pen? Yes. I have a few more if there's a few more.
Up on your own, but we'll kind of get started. So we've already talked about me. So Maggie, thank you for the introduction. I have practiced in small hospitals, big hospitals, trauma centers, academic centers, pretty much up and down the East Coast. So I've kind of seen it all.
Is it possible to dim the lights?
Oh, yeah.
Oh, sure.
Can we do that? I don't want to touch any buttons.
It's a very good idea.
And I've seen a lot of patients. I was basically trained in the traditional way of doing things. So I think that there's incredible things that modern medicine can do. But I also think that there's some gaps. So we'll talk a little bit about that. So the way this kind of gets laid out is this week or today, we're going to talk about really what are the drivers of chronic disease, because I think that there are specific things that are increasing the rates of certain chronic diseases that we'll actually talk about. And then we'll talk about really what are the 4 pillars of health. They're on your piece of paper, so they're not going to be surprising to you when I talk about it. And then we'll really focus on the kind of first pillar, which is what I call mental resiliency. I'll define it, and then we'll kind of go into it in a great level of detail about exactly what that is and what that means and how it impacts your health. Next week we'll talk all about nutrition, because that is, I think, one of the most important things that we can do to impact our health. There are 2,000 to 2,500 calories that you put in your mouth every single day will impact your health probably more than just about anything that you can do. And we'll talk about the different types of nutrition and what works and what doesn't work and some of the fads that are out there. And really, we'll kind of come up with a plan, your personal plan for what you're going to do in the next week after that. And then the final week, it's going to be about movement and sleep. And those are the 2 other pillars that we'll talk about, and kind of try and pulling it all together. Sound good?
Yeah.
All right. So these are the 4 pillars, right? Mindfulness, it's all about kind of how you stay as mentally strong as long as possible. And there are actually techniques that you can do to do that, or to do that have been proven in the medical literature. And we'll talk through that. Nutrition we talked about. Sleep, which is really interesting, a lot of data coming out about sleep, how it impacts our long-term health and well-being, and we'll go into that in a fair amount of detail. And movement. I like to say that nutrition is different than diet, because you can stay on a diet for a while, but you're not going to be able to do it for the rest of your life. If it's the nutritional regimen that you can follow that's going to be good for you, you can do that for the rest of your life. And similarly, movement. It's not about exercising. It's not about going to the gym 3 times a week. It's how you move every single day and keep yourself mobile. And we'll talk about that when we get to it. So I have a practice in integrative medicine. And a lot of people probably are scratching their head saying, exactly what is that? And I think someone asked as she was walking in, exactly what are you talking about tonight? So integrative medicine really looks at kind of 3 main areas. The first one is traditional healthcare, right? You go to your family doctor, you go to your primary care doctor, he or she will see you, will refer you to a specialist, give you medication, give you some tips on staying healthy. That's kind of what we think about as traditional healthcare. The second one is kind of self-care, right? What you can do, and you can actually do quite a bit, to actually control your own health. And those are some of the things that we're going to talk about over the next 3 weeks. And finally, there's this concept of what's called complementary and alternative medicine. It used to be called alternative. I like to say that for those of us, there's a school right across the street, the Maryland University of Integrative Health, right literally on the other side of the road. They train people how to do certain things, including acupuncture and how to be health coaches. My health coach will be arriving shortly, and she graduated from that school. And when you think about, let's say, traditional Chinese medicine, right? For us in the United States, that's kind of an alternative healthcare system, right? But when you think about it, for like 1.3 billion Chinese people, it's just medicine. That's just how they get their care. And you can make some arguments that some of the outcomes that other types of care is getting may be a little bit better than ours. And we'll talk a little bit about that. And then integrative health is really how you put all of those 3 together. So my practice is using all of the things that I just talked about. I'm not averse to drugs, but I'd like to get people off their medications, and I've been able to do that. So that's something that I think we have to think differently about. So this is healthcare in America. So if you got a problem, we got a pill. If you have high blood pressure, we have antihypertensive medicines. If you have high cholesterol, we have statins. If you have depression, we have SSRIs and other antidepressants. That's healthcare in America. I was part of that for 25 years. And there are some really good things that we do. And there's some amazing things that we do. But there's also the downside of it, right? And we all know what that is. I mean, the most extreme example of that is opioids and what we've done with opioids and chronic pain, right? We've made people addicts. I've made people addicts by prescribing those. We haven't done any people a service by doing that. So we have to look at things differently. So why did I get interested in this? This is a kind of a tough graph to see, so I'll orient you to it. This is from the Organization of Economic Cooperation and Development. Basically, it looks at the top 30 or 35 industrialized countries, and it looks at a lot of statistics, population statistics, economic statistics, healthcare statistics. This is the cost per person per year in 2020. The middle of the graph is about $4,000. That's the median. We are all the way on the left. We're over $10,000 per person per year in the United States. And that's not terrible, right? So if we pay twice as much for our health care, the question is, are we getting twice as much for it? And I would tell you we're not. We don't have the longest life expectancy in the world, not by a long shot. We're about 3 or 4 years behind the ones that do have the longest lifespans. We don't have the highest infant mortalities in the world. We don't have the lowest, I should say, infant mortalities in the world. We're actually on the bottom third of the scale. We don't have the lowest maternal death rates in pregnancy. We're actually on the bottom end of the scale. So the question is, we're spending twice as much as the average industrialized country, and we're not getting the kind of results that we should be getting. And one of the things that people say is, well, America's a very diverse country, we have haves and have-nots, we don't have universal health care, all true. But if you look at the people at the highest end socioeconomically and cut it across all these other countries, even those people don't do as well. So, the question is, why is that? This is the other reason I got interested in it. Some of you may recognize this lady. This is my wife, Amy. This is at a Pink concert. Has anyone ever gone to a Pink concert? If you ever have an opportunity to go to a Pink concert, go to it. I was not a Pink fan before I went to the concert. I was a big fan afterwards. She's a fantastic performer. So Amy gave birth to Chance, our youngest, appropriately named, because there was no chance in heck that she was going to get pregnant, and at 44. And after she gave birth, she just was not doing well. For months afterwards, she had chronic joint pain. She was brain fog, couldn't get out of bed, was crawling up and down the stairs. She went to see her primary care doctor, went to see her OBGYN. I know doctors, so they were pretty good doctors, and they did some blood tests and they did the usual stuff. And then they said, there's nothing wrong for you. And she heard from her female OB what every woman at 44 wants to hear, which is, you're an older mom, just gonna take a little bit of time, you'll be okay. So she said, something's wrong here. So she said, I'm gonna go see this nutritionist, right? So I said, whatever. This was 12 years ago. I was like, no, 14 years ago at this point. I said, whatever. So we went to see the nutritionist. After about an hour, just talk to her. That's all. No tests, no blood tests, nothing else. She said, I think you may be celiac. To which my wife said, and I won't say exactly what she said. She said, I think you're full of crap because I grew up on a wheat farm, which is true. She grew up on a wheat farm in Ohio. The family farms it. They still farm the land there. And the nutritionist said, humor me. Take all gluten, all wheat out of your diet. Just see how you do. She said, okay. 2 weeks later, many of her symptoms are gone. 4 weeks later, all of her symptoms are gone. Wow. So she developed celiac disease, which everyone thinks about as being due to a gut thing, right? You're allergic to wheat or you're sensitive to wheat. It's actually an immune-related reaction. And the stress of her pregnancy, she got gestational diabetes, she had to be hospitalized a couple times during the pregnancy. It was a very tough pregnancy. The stress of that actually triggered her to develop celiac disease. She had the genetics for it, but it never expressed itself. So that kind of opened my eyes that, maybe not all of us doctors have all the answers, which we don't. And maybe there's a different way to look at healthcare. So there's a concept called lifespan versus health span. Pretty simple, right? Lifespan is how long you live. Health span is how long you live your most functional life. We all know 70-year-olds that are out there on the golf course. playing tennis, doing things that they want to do, and we all know 70-year-olds that are in nursing homes and not able to communicate with their families. And I certainly would prefer to be the former rather than the latter. But that's the difference between just living your life and really living your best life. And that's what we're going to be talking about. All right. So what are the largest life-limiting diseases that will impact you? In other words, what's going to kill you? So, you know, there's only several final common pathways out of this life, provided that you don't get taken out early from some tragic event or an early cancer or something like that. And it really revolves around these three diseases. It's cardiovascular disease, which is both your heart and your brain, the cardio and the vascular, cancer, and neurodegenerative diseases like dementia, Parkinson's, and others. 70% of chronic disease is preventable. I didn't misspeak. It's preventable. That means that you have the opportunity not to have those diseases. While all of us will go out by one of these three mechanisms at some point in our life, we want to delay this as long as possible. And there are ways to do it. The flip side of it, we also know that increasing rates of cardiovascular disease, despite better therapies, increasing rates of diabetes, we have a pretty good reason as to why, although we're not quite sure why. There's an epidemic of obesity going on. We kind of know that that's causing a lot of other issues. Things like rheumatoid arthritis. I have several patients with rheumatoid arthritis. One, I'm in the process of actually getting her off her biologic because we took a different approach to rheumatoid arthritis. Hashimoto's thyroiditis, much more common in women. And a lot of these chronic diseases actually fall more to women than men. And that's some of the challenge we have in our healthcare system is the disparities in care that we have. But there are clearly a rise of these chronic problems. Even autism in children, we've seen dramatic increases in autism over the last 25 years. Nobody quite knows why. There's a lot of theories out there, but I'll talk about some of them. So these are the statistics. 6 in 10 of us sitting in this room will have one chronic disease as defined by those pictures underneath it. And 4 in 10 will have 2 or more. Right? That's America. And they really boil down into those 3 areas: heart disease and strokes, cancer, and neurodegenerative diseases, dementia, and other things. To put a finer point on it, this is from the National Institute of Health and the National Cancer Institute. This is your individual risk over your lifetime of getting cancer. For women, it's 4 out of 10. For men, it's 1 out of 2. That doesn't mean that you're necessarily going to die of the cancer, but you'll definitely be touched by it. The belief is that about 50% of cancers are completely preventable if you look at throughout the literature. And it's really interesting if you look back from the early 1900s, which they started tracking the data on cancer, and how long people live with cancer as a disease. And you kind of fast forward to 2020, like 120 years later, and you look at the graph, and they have these graphs. It's really interesting what you see. A lot of the cancers are pretty much flat, surprisingly. You see this huge run-up in lung cancer because of smoking. And consequently, over the last 30 years, we've seen this really big decrease in lung cancer because we're smoking less, right? But if you take that out, and there's been some incredible therapies in cancer, immune therapy for people with malignant melanoma and other things. There are remarkable things that we can do. And I'm sure that there's people that are living here that are cancer survivors. So I'm not taking any of that away, but if you look at the long-term statistics, it's not a lot different from the early 1900s, which is kind of interesting.
Why do you call cancer a chronic disease?
Well, the belief is that it is because something has happened at the cellular level, and that's something they've started years before. So the chronicity of it, how long it's lasted, as opposed to something that's just come out of the blue in the last 6 months. And then the question then is, okay, if we treat the cancer, what's your risk of reoccurrence, and how much is your risk depending on the stage of your cancer, and what are the things that you can do? There's a lot of things that you can do personally to lower that risk of recurrence. That doesn't involve, what new chemotherapy drug and everything else you need to take. It's about how you're gonna live your lifestyle, what nutrition you're gonna do, exercise. There's a lot of good data about that. But from being a chronic disease, because if you think about colon cancer, the belief is that colon cancer starts years before. So in some sense, it is a chronic disease. Make sense?
So, I mean, I understand that chronic, once you have it and you're progressing, but the initial occurrence of it, I don't know if you can lump all cancers in.
Oh, I totally agree with you. I totally agree. I'll give you, certainly there are some cancers that just happen abruptly and they're not chronic. You take care of it, and they're gone. But there are others that have been around in your body for a long period of time. Yes, sir.
You did recently mentioned 120 years of data.
Yep.
One of the arguments you hear a lot is, well, they're just monitoring it more closely in the last few years, and that's why there's a lot more autism than there. It's always been there, we just didn't monitor it.
Yeah.
What do you say to that?
I think it's all true. I think that there is something about kind of how we're defining it, how sensitive we are to picking it up. I think there's a lot of truth to that, so I'm not dismissing all of that. But if you look at the large number, the population number, specifically regarding cancer, yes, we've made progress. It's not as much as people would think, just off the thing. And autism specifically, there's a lot of controversy as to what's causing autism. Is it an environmental factor? Is there something genetically? Are we more sensitive to picking up the diagnosis? I think we are, but I also think that rate is rising, and there's not a really clear reason as to why. So, and you got to think about any of these diseases, over the last 20 or 30 years, whether it's rheumatoid arthritis, inflammatory bowel disease, certainly cardiovascular disease, and that is absolutely a chronic disease. It's amazing to look at some of these numbers and compare it to 20, 30, or 40 years ago, and our genetics don't change that quickly, right? It's not like the human being's genetics have suddenly changed in the last couple of generations. There's other things that are going on, and we'll talk about some of that. Other questions or thoughts, challenges? Okay. All right, so this is one of them. I'm going to talk a lot about this in the nutrition section next week. This is kind of an interesting graph. It talks about, it looks at the amount of food that's produced in the United States, and it kind of boils it down to, well, what does that turn into regarding calories per person, right? It's not a perfect measurement, but it's the one we got. So if you look at this, you notice a couple of things. 1970 to 2014, yes, 2014. So over a 45-year period. The inner ring are the number of calories that people ingested in 1970. The outer ring is 2014. The first thing that you do, if you add up those two numbers, the inner ring is just under 2,000 calories. The outer ring is just under 2,400. So it's a 400 calorie increase per person over the course of 40 years. So that may have something to do with chronic disease. We're just eating more food. The question is, where are we getting that food? And the one that really sticks out to you is the one in the gray bars, which are added fats and oils. And that's not necessarily the cooking oils that you used to cook your chicken in on the stove. It's all the oils that are produced and put in all the foods that we eat, all of the processed foods. We'll talk a lot about processed foods and the impact it has on your health. But this is certainly one of the things that we think may be causing some of the challenge. The increased number of calories that we're taking in, and specifically around things like seed oils, saturated fats, those kind of things. All right, so has our environment changed? So this is kind of interesting. Since 1900, about the last 100 years, 90,000 new chemicals have been put into our environment, right? It's just, that's modern day manufacturing, right? from plastics to the chemicals that we use and all the processes that we have. And about 1,000 new chemicals per year are invented or created. The vast majority of them have not been tested on humans or the impact it has on humans. Only 5, according to the government, I think it's now up to 10, have outright been banned. Things like DDT and those kind of things. Very few of them are just saying you can't ever produce those anymore. Over 1,000 of these chemicals are what are called endocrine disrupting chemicals, which means that when it gets into your body, it acts like a hormone, and it can affect certain body systems. It's one of the theories why we think increasing rates of breast cancer and uterine cancer, because they're hormone-sensitive cancers, are due to some of these what are called endocrine mimics. Similarly for men for prostate cancer. And if you're interested, and I highly recommend that you check out this website called the Environmental Working Group, EWG.org. It's a nonprofit. They do a lot of this. They've been around for the last 20 or 25 years. They will look at things in the environment and tell you if it's safe or not. One thing I recommend is that for women and men, if you're using sunscreens or cosmetics, there are certain things that will get absorbed into your body that you don't want necessarily in your body, and EWG will rank these as healthy or more likely to cause problems. They're also famous for something called the Dirty Dozen and Clean 15. They basically rank all the foods based on pesticide load, and they'll tell you which ones have the highest pesticide load, so you should really think about getting those organically if you have the opportunity to do that. And similarly, what are called Clean 15, which are the ones that if you eat conventionally, they're probably okay. So I highly recommend that website. So this was an article literally in the Wall Street Journal on Monday. So I thought I took a snapshot of it. I thought I'd put it in here. And it talked about a town in Wisconsin where they had groundwater contamination from what's called PFAS, which is a chemical that's used in firefighter foam. There was a manufacturing plant that bordered this town. They think that several hundred, if not several thousand, wells have been contaminated over many years with this chemical called PFAS that can actually cause a fair amount of harm that people have probably been drinking for years and years. So my only reason of saying this is not to kind of scare you, like, what can I do? There's actually a lot that you can do. And this one is the last one that I'll show you, and then I'll tell you what you can do. Everyone heard about the controversy with Roundup? Yep. So Roundup is, the chemical in Roundup is called glyphosate. It was developed as actually as an antibiotic, believe it or not, and then they found that it could be used as an herbicide. It basically kills herbs. It's the highest chemical that's used as an herbicide. I think there's something like 1 billion pounds of it sprayed on crops every year. The feeling is, and this is controversial science, is that they think that it may disrupt some of the connections in our gut, this kind of leaky gut, which I'll talk about in a little bit. They've actually pulled it off the consumer market in 2023. They're no longer going to manufacture it. But they will be still in the agricultural market because that's what's used for it. So this is one of the reasons why some people like to say organic is better. I do think it's probably better, and if you can buy organic, just because of all of these issues, it's better for you to do that. So what can you do about environmental toxins? So this is what I tell my patients. I do an environmental screen when I see my patients. I basically tell them, okay, the worst thing that you can do is microwave plastic. That's like the worst thing you can do. So if you got a plastic food container, please get rid of them, and certainly don't microwave them. Use glass. That's probably the best thing that you can do. No plastic water bottles. The stainless steel water bottle, because number one, environmentally, it's not sensitive, and number two, some of the plastic in the material on the bottle actually does leach into the water, and you're drinking it. So I don't recommend you doing that. Sometimes it's unavoidable, I get it,
I heard it'll especially leak if you leave it in your hot car.
Oh, absolutely, that's the worst thing to do. Yeah, if you heat up the plastic, it's going to leach those chemicals.
Yeah.
Yep, that's the worst thing we can do, absolutely. Organic one, when you can, and I understand for some people it is a financial issue, but check out the Dirty Dozen, because I think it's really, that you should at least try and get organic. There's this whole controversy about nonstick cookware. You should definitely not use it, because Teflon's been taken off the market, but there's others that have replaced that. That can actually leach into your food, and then you ingest that, and it causes problems in your body. Like I tell my son, who's now 12 years old, so it was a mandatory that he get a cell phone, because every kid that was 10 years old had one, and I was holding out till 13, but I didn't make it. So he put his cell phone in his front pocket, and I said, nope, don't do that. Try and keep it away from you. And other simple things like, everyone's got a can of Raid in their house, right? To kill whatever, the bugs or the bees or whatever. Don't spray it on a regular basis. Pesticides have definitely been shown to cause neurodegenerative issues when used over a long period of time. If you need to use it, fine. Just don't use it every week. And then, as I mentioned, there are personal care products that have chemicals in them called parabens, which are the things that can get absorbed in your skin, and they can cause some problems long term. And you can check out whatever cosmetic you're using at EWG. They have a list of thousands of them, and they'll recommend which ones have the lowest toxicity. Really good for sunscreens too. I actually look at it every year when we're buying our sunscreens. All right.
Shoes at the door?
I'm sorry?
You said take your shoes off at the door?
Oh yeah. So the feeling is that there's a lot of chemicals that are in outside that if you've gone to work and you come home, you should probably try and not track that through. If you check your dust in your home, and they've done these studies, huge amount of chemicals, you'd be surprised. And it's usually because you're tracking it through from the grocery store or Home Depot or your workplace. So keep your shoes at the front door. In addition to all the other things that we do, my wife and I actually own a farm in Brookville. We grow vegetables and have 300 chickens when they're not getting killed by fox. And we actually have a bath where we step into before we go into the greenhouse to kill whatever's on our shoes. So I don't recommend doing that anymore. All right. So the balance of what we're going to talk about here is really focused around these three areas, right? It's the food you put in your body, it's how you treat your body, and how you keep your mind sharp as long as possible. And it is these four pillars. It's nutrition, it's movement, it's sleep, and it's mental resiliency. So let's talk a little bit about mental resiliency and what I mean by that. So there's four components to mental resiliency. One is what's called mindfulness. To me, mindfulness is how you calm your mind. We're all in a greater or lesser degree of stress, certainly in the United States. We all have a level of stress. The three of the most common complaints we hear in our practice are anxiety, inability to sleep, insomnia, and weight issues. Those are the three things that are very common, amongst other things, but they're probably the top three that people complain about when we're talking about how they want their life to be better. So mindfulness is just this concept of how you calm your mind. There's been some really interesting studies done looking at transcendental meditation. Has anyone heard of that? So transcendental meditation, for those of you that haven't, is a very formal way of meditating where you actually get trained in it. You do it twice a day for 20 minutes. Right? And it's using a mantra, something you repeat to yourself over and over again. And these studies were done 20, 30 years ago in major cardiology journals. And they showed lower long-term rates of death, lower blood pressure, lower cholesterol, just doing transcendental meditation, as much as they can control for the other things. So if doing meditation is something that's going to have that kind of impact on your health, then we should probably think about, maybe that's something we want to make time for. And most people will say, well, I don't have enough time to meditate, right? I don't have time for 10 minutes. There's an old joke about meditation, and I meditate almost every day. If you don't have time to meditate for 10 minutes, you should meditate for 20 minutes. The The second concept is kind of constantly learning. If we're in the workforce, it's not as much an issue because you're constantly being challenged at work. But once you leave, you know, things change. I mean, I saw it in my dad. My dad retired at 60, and probably 5 years later, he started having a particular type of dementia that now Bruce Willis has made famous called primary progressive aphasia, where he lost the ability to speak. And over time, it generalized. Now, did he get that because he stopped working? Probably not. But the whole concept is you want to keep your mind sharp as long as possible. There's been three types of things studied that have shown that there are ways to do this. First one is learn a new language, right? So if you ever want to learn Italian, now's the time to do it. Second one is learn an instrument. So if you ever want to play the guitar, no time like the present. And the third is to teach. Learn something and teach it to people because that will stimulate, those activities will stimulate multiple areas of your brain. And that's what you want to do. You want to keep your brain sharp. It's great doing Sudoku and crossword puzzles and Wordle. Those are all good. But those three types of activities have been shown, science has shown that they actually activate multiple parts of your brain. So you may want to consider building that in over time. What I call strengthening the tribe. As we've all learned from kind of COVID, we've all learned about being isolated. Loneliness is a huge issue for a lot of people. And we need to be able to, I think I'm speaking more to the guys than the ladies, and I'm being sexist here. I think women are much better at it. Guys tend to not take the time to kind of build the relationships, especially with other male friends. And that's important. You want to know that you have a tribe, a group of people that you travel through life with that is going to support you when you have difficult times, and conversely, you're going to support them when they're challenged. Your spouse is great, and that's important to work on those relationships, but you want to expand that circle as much as possible. And then finally, spirituality. We're in the church, but there's a lot of good information I'll talk about in a minute about spirituality and faith and what it does to longevity. Yep.
I wanted to point out for mindfulness, you talked about meditation, but we're in a church. One of the most meditative prayers is the rosary.
Yep.
And it takes 15 minutes. I posit that transcendental meditation might lead us away from our faith. And the rosary, you know, it's 15 minutes, it's right at the time you're saying, and it's very meditative because we're supposed to consider parts of the Blessed Mother's life or
Yep.
Jesus's life.
Yep.
And I might want to say, or suggest that maybe instead of transcendental meditation, the rosary might be a good.
Yeah, we're going to talk about different things that you can do from a spiritual standpoint to strengthen that. I think that they can both be complementary. I think, you know, there's a lot of different Catholic prayers you can do. I do on occasion the Examen, which is a Jesuit prayer that you do at night where you reflect on your day, kind of what happened, what went well, what didn't went well, how is God touching you in your life. So there's a lot of different things that can be done, and I pray the rosary on a regular basis, usually when I'm driving on 695 to take my son to school. So you're right, you're absolutely right. But I think for a lot of people, I mean, there's a reason that there's two things that have really, over the last 20 years, has shown a tremendous increase in number of people doing it. One is meditation, the other is yoga. And we'll talk about yoga in a second. And I think there's a reason for it. Prayer is certainly an option to do that as well. So, and I would encourage that. So mindfulness, when I talk to my patients about mindfulness, there's a lot of different ways to be mindful, right? So what's the science behind being mindful? So I talked about the high stress that we're all under, right? Especially in America. I mean, we all think the tiger is chasing us, or some guy cut us off in traffic is you know, he's intentionally doing that, or she's intentionally doing that to mess up our day, right? So, of course, that's not the case, but we think it is. And that chronic low level of stress, you have two different systems in your body. The one is what's called the sympathetic system. People have heard about the fight or flight, right? You know, if someone's chasing you, your pupils constrict, you push blood to your muscles, your heart rate goes up, your blood pressure goes up, you're ready to do whatever needs to be done to defend yourself, right? That's the sympathetic response. And the balance part of that is what's called the parasympathetic system. It's what's called a rest and relaxation system. And that's what meditation, prayer, these mindfulness activities do, is they rebalance that system. So they try and increase the parasympathetic system to lower cortisol release, to lower your heart rate, to lower your blood pressure. And there's very good studies that have been done over many, many years, over many different groups of people. So there are 4 different specific mindfulness activities that I talk to my patients about. One is what you see the woman doing in the park, and when I do it, I usually have a dog barking in the background and kids screaming, so it's not that restful, but that's the idealized way to do meditation. The woman on the lower left is doing some breath work. We're actually going to practice a little breathing exercise. Breath work does the same thing. It tries to rebalance that sympathetic and parasympathetic system. The folks on the bottom are doing yoga. Yoga is a great activity because it does 3 things. Number 1, it's movement, so you're moving, which is great. Number 2, there is some breath work involved in yoga, and there's also a meditative part of yoga. So it kind of incorporates all 3, and it's popular for both men and women. So that's certainly something that you can try. And then finally, the gentleman on the right is praying, but I put it up there as a gratitude practice. And there's lots of different ways to do gratitude. You could do it through prayer. You could do it through writing down in a journal, being grateful, or reviewing why you're grateful for the day. So there's lots of different ways to get to this kind of calming of the mind. And you can pick any one of those 4, or certainly prayer, which we'll talk about in a minute. So there's lots of different options. The other one that not a lot of people think about is going outside and walking in nature. Just being, just really appreciating being out in nature. It was funny, during COVID, about 6 months into it, I live over off Tradelphia Lake, off the reservoir. And I have a state park about a mile from my front door of my house that I never knew about. So I actually found this state park that's right up 97, and I used to go there once a week, and I still do. And I just walk in the woods. It's a 2-mile trail, completely covered with woods. You would think you were in the middle of nowhere. And those are things that you can do. If you live in the inner city, it's a little bit different. But taking time in nature actually is incredibly helpful for relaxing you and decreasing all those stress hormones. All right, you ready to do a little breath work? Okay. So this is what's called a 4-7-8 breathing exercise. Same concept. What you're doing is through this breath work is you're calming your sympathetic system. So I'm going to demonstrate it, and then we're all going to do it together. All right. So you start out. Normally you're sitting down, but I'm going to be standing. And when I count, I'm going to count on my fingers. 4, 7, 8 refers to 4 count breathing in, 7 count hold, 8 count breathing out. It's also called by some box breathing. You may have heard that term, box breathing. For the people that think this is a lot of woo-woo stuff, they teach this to special forces. So if they're teaching it to special forces, there's probably something good about it. So I'm going to do the 4, 7, 8. So just kind of sit there for a minute. I'm going to count on my fingers. So you just rest for a minute. My eyes are closed, trying to get into my happy place. So what we're going to do is we're going to do 2 rounds of it. I'll do the counting. You guys can kind of sit in your seat, hands on your lap, cross, doesn't really matter, as long as you're not like slouched in the chair. And what we'll do is take a couple normal breaths. And then when I say now, we can start counting. So just breathe normally. You can close your eyes, relax, you're in a safe space. Ready? Take a deep breath in. 2, 3, 4. Hold. 2, 3, 4, 5, really good if you're having trouble sleeping. You could do 3 or 4 rounds of this before you go to bed. Anytime you're stressed, except if you're driving, I don't recommend going to bed. Unless you're stopping. So, yeah.
Should you breathe in your nose and out your mouth, or what's?
There are subtle differences to that. It, quite frankly, doesn't matter. So you can nasal breathe or you can mouth breathe. That's really up to you. There's some subtle differences depending on if you use your nose or your mouth, but it's not worth it. It's just more what you're comfortable with. Any other questions?
2 sets. So it's always 2 sets.
It doesn't have to be 3 or 4 if you're having trouble sleeping, like as a routine to get yourself to go to bed. That's usually I recommend 3 or 4 times. And you can do it in the morning when you first wake up as kind of a centering. After your centering prayer, you can do the breath work. So, other question?
What levels of anxiety are you speaking of for all of these? You know, somebody that's normal, anxious about
Yeah.
things, or somebody who's got a real anxiety issue?
Yeah,
You know what
great question. I think they're helpful for anybody. Obviously, if you have anxiety to the point where you're not able to function, where it's really affecting your day-to-day or your relationships, then that's something that obviously you want to talk to your doctor about. But in general, I have patients with anxiety and depression. I teach them how to do breath work all the time because I think it could be helpful for them. It certainly doesn't hurt, but like it's not a cure for people with severe generalized anxiety disorder. Absolutely. So, other questions? Yeah.
Is this also applicable to if you're in pain?
Yes. Actually, there's a very interesting guy. I think I typed him out on your handout, called Wim Hof, Wimhof. He's, if anyone's ever heard of the Iceman. So he has, and he's actually been studied, not only him, because some people call him a freak of nature, but it's a long-winded response to your question. But he's actually made popular this rapid cycle breathing, where you breathe in and out 20 to 30 times, and you do it several times. There's a belief, and it's been proven actually by people that have studied him and people that he's taught this technique, that it can actually lower inflammation in your body and improve different things like joint pain and those kind of things. So that rapid cycle breathing is a little bit better. This is more for just generalized relaxation, but certainly for pain, like I said, it's the same answer, it doesn't hurt. So, but if you really have a painful condition, you should check out Wim Hof. It's something I've recommended to some of my patients. I've gotten good relief with it.
Could you spell that for us?
Wimhof. Best place to look at him is on YouTube. He's got like 30 million views on YouTube or something like that, something ridiculous like that. He's got a couple books out about it as well. Okay, any other questions?
Here's one.
Yeah, when you're talking about pre-diet, some people might not.
Yeah, so what you want, that's a really good point, and I didn't go into that. So what you want to do is, most of us are typically just breathing in our upper chest, right? We're not fully expanding our lungs, so we're just doing on a day-to-day basis. What you really want to do is take a full breath in, so you're pushing the air as deep as you can into your lungs. So you actually get some, your abdomen is actually pulling down on that. So yeah, absolutely, it should be a full breath. I mean, it should not just be that's not what we're talking about. Yep, absolutely. Okay. All right. Okay, let's talk about faith. There's been really a lot of studies done that have shown they've compared people with strong faith and people with very little faith. And my apologies to the atheists, I doubt that there's any in this room, but that it will add, on average, between 5 to 10 years to your life. Just if you have a strong faith versus someone with very little faith. And the question is kind of why, and you've mentioned it. I think there's a lot of stuff about a practice of faith, and obviously we don't corner the market, although Christianity is the largest faith in the world. But it's focused on these things about, being grateful, using prayer on a regular basis, and meditation is part of your faith. Meditating on different aspects of your faith. And I think it also ties into what's called purpose. I mean, I think a lot of the challenge with people, especially as we age, we start to think about like kind of what is our purpose in life. We had this job, we had a career, we raised a family, now they're gone, and like what is my purpose in life, right? So it's like, I think that's where we lean on faith. Not 100%, but that's kind of commonly where we do it. I think purpose is like, does life make sense? I mean, is there a reason for this? And certainly is there a reason for me being in this life? Like, is what I'm doing matters? And I think that, do you have a long-term goal? And I think that faith we believe in a higher power, we believe in Jesus Christ, we believe in God, and that there's a reason for everything. We don't necessarily understand it, but we believe that there's a faith and there's a reason for it, so it gives us that purpose. And I think that that's a great thing about anybody with a strong faith. And there's some interesting data that's coming out now. It's not only about this long-term big picture of like, where do I fit into all this, right? I mean, I know I'm not going to figure that out until I'm long gone and hopefully on the other side. But, part of what you can do is just try and be present in the day-to-day, right? When you walk outside and you see the sky and you see a beautiful rainbow or the clouds, do you sit there for a minute, even if it's only for 3 seconds, and say, wow, that's just beautiful? And really be present in that moment. I know, certainly have had 5 children, and I had my oldest, her husband, and 3 children living in my house for the last 16 months. It was hard to be present. They now have a house in Colombia, thank God. But, it was, some days were just really challenging. But we have to find those little tiny moments in the day where we understand that, where God's providence is and what it's all about, and then how we fit into that. So, I give this talk all over the country, and or a version of it, and it doesn't matter what your faith is. Certainly, I'm biased, but have something that you lock onto. And it's interesting. I had this conversation with this woman who's thinking about becoming a patient to me, and she said, well, how do you think about mental resiliency? What does that mean? So I went through basically what I'm doing with you on the phone, and I got to faith, and I said, I've started talking more openly about spiritual practices with my patients, because like religion and politics, right? It's the 2 things you don't want to talk about, right? So, and I said, so faith is an important part. You don't have to have an organized religion, as I was talking to her on the phone, but I think you should have something that you believe in, and think about that on a day-to-day, on a deep basis. And she said, no one's ever said that, but I married someone who's Jewish, and like we don't really practice Judaism, but it's caused problems, and I'm trying to figure that out. So like, how can you not talk about that, right? I mean, that's part of who you are, and trying to figure that out and work through those struggles, that's part of that is faith. So I think it's an important component of overall wellness and health, is the bottom line. All right. All right, it's time to get to work. It's 8 o'clock. So my suggestion is you think about a mindfulness practice. Now, it could be prayer, and that's fine, but those are some of the options, right? It talks about Wim Hof, that's how you spell it. Gratitude practice, like journaling and those kind of things, is fine. And then I would invite you, and I'm talking to the guys, tell a friend, they can set up a lunch date for the next week. So for the next 10 minutes, you guys are going to think about kind of the stuff I talked about, specifically around mental resiliency. What would you like to implement in the next week? So let's take the next 10 or 15 minutes, because we're going to build on this over the next 2 or 3 weeks. And then maybe we'll have a little bit of sharing for the last 5 or 10 minutes. All right, get to work. Any questions first? All right. I'm going to put the light on.
Bob, we'll turn on the lights.
Okay.
That's tough.
So I usually wake up 10 minutes early. So I'll wake up. Sometimes when kids are on the house, oh, we'll talk about that. You gotta stick with me. There's a whole structure around sleep. Oh, really? Oh, like our family? Oh, I thought you meant, I've never been royal family.
Anyway, all that. Yes. Somebody was on vacation. So, okay, I know this was quite for me, I really have
Me too. I can tell you do it. It was like, I got such a headache.
Hey Teresa, how you doing?
Okay, she was in St. Francis. Just did your way. Not even our guides.
Yeah, well, that would have been a strong possibility. Yes, sir. All right, we ready? Glad everyone's having a good conversation. All right. So, a couple things that I was reminded of. I did list a couple of different apps on that, and I didn't explain it. For meditation, Calm and Headspace, which are written on your notes there. They're two really good ones. Insight Timer and tell me the
Hallow,
Hallow.
HALLOW, and Sacred Space.
Sacred Space. Okay, those are two of the great ones. I will actually check those out.
Sacred Space.
Hallow and Sacred Space.
Hallow is the number one app in the world.
Oh, is it really?
Yes.
I did not.
At least that's what their recent
That's what it
ad
says
said.
on their website.
It says it must be true.
So,
Yeah.
so part of this is, and like I said from the beginning, all the stuff we're talking about is kind of simple stuff, right? This is not earth-shattering stuff that I'm talking about. It ain't easy, because if it was easy, then we probably wouldn't have some of the issues that we're dealing with today. So, is anybody willing to share what they're going to be doing? Let's pick one thing that you're going to be doing over the next week to try and take a step forward here. Anybody want to start? Or I'm going to start picking people.
I'm gonna do the breathing.
Breathing, awesome, excellent. We'll stick with the back table. Why don't we go around the back table?
Gratitude.
Gratitude? Okay. How are you gonna practice that? Do writing it down or
I'm
prayer?
gonna start writing it down,
Okay,
because I already pray and meditate, so.
good, excellent,
Breath work.
okay.
And the breathing.
Breathing, okay, good, I've convinced a lot of people to do breathing. Teresa, anything you're gonna do?
I'm gonna do gratitude as well. I have a gratitude journal that I bought last year that I've kind of stopped doing, even though I am Dr. Falcone's health coach. Hello, everybody. A little late today. I went to the wrong church.
She was at St. Francis.
But even though I am a health coach, doesn't mean that I do all these things, every single day. There's things that I want to work on as well. So gratitude is definitely one of them. Yeah.
Anybody else? I'll take this.
I said breath work because it was an easy, short one to stick to, short stick.
Yeah, and Chris asked me, like, how do you fit all this in? So I told her kind of my practice, right? I always start, like, consistently doing this about 2 or 3 years ago. So it's not like I've been doing this for 20 years. So I get up at about 6:15 in the morning. I got to help get my son, who goes to school in Owings Mills, and Amy and I kind of switch off driving him to school. So I'll get up like 15 minutes early. I'll read the Bible passage for the day, kind of think about that for a minute or two, and then I'll just meditate for about 5 to 10 minutes. So that's like my 10 or 15 minutes in the morning before the day really starts. And everyone, and even if you do something for 2 minutes, the way Teresa and I kind of talk to our patients is, if you're going to start something new, link it to an activity that you're already doing. Like, if you're making a cup of coffee in the morning, then make that the trigger for you to do whatever this new activity is, because you're going to make your cup of coffee or a cup of tea every morning. And then just take that 5 minutes, and while you're making your coffee or having your water boil, you can do something for those 5 minutes and just kind of build on that. And that's really how habits form. You got to link it to something that you're already doing, because trying to do something new for 30 minutes a day is not going to work, right? I mean, it's just not. So you try and kind of build it in. So great. Anybody else?
I'm gonna take a walk. I used to do the breathing, I'm gonna go back to that, but I'm gonna start taking a walk every day. Great. Because I need to get out.
Yeah. We all need to get it. And the weather's getting nice, so you can't argue with that.
Well, I do these things. So
Good. Awesome.
Because I've
Overachiever.
practicing yoga.
That's awesome.
These things for my yoga practice.
Well, that's awesome. Awesome. Well, good. Keep doing it.
I don't want to brag.
That's right.
I'm gonna do Alexia Davina with the daily readings, like you're talking about.
Yep.
Right? And then I used to do this exercise where I would have a conversation with Jesus and meditate and try to listen to him, what he has for me, in store for me for the day. I'm gonna try to do that again.
Good. Awesome.
Just gonna breathe before going to sleep.
Yeah, it's great, especially for people that have trouble with kind of that whole. We'll talk a lot about sleep in the third week. There's a whole process that I kind of break it down into what's called sleep hygiene, as well as sleep disruptors and other things. So we'll get into that, but that's great. Awesome. Yep.
If you have it in Alexa at home, you can ask her to play a guided meditation, and it's like from 1 to 5 minutes.
Oh, that's a great
It
idea.
works up to the 5 minutes, so usually it's like maybe 3 minutes.
Oh, that's a great.
And you just ask her to do it, and it's over within a couple of minutes. It's really calming.
Oh, that's fantastic. Thank you. That's awesome. Let's stick with that table. Yes, sir.
I tried meditating and saying the rosary,
Yep.
but every time I've tried it, and I've given up on it, every time I've tried it, my mind gets bombarded, random thoughts.
Yep.
I can't keep them out. I start going in that direction. Finally, it's like, what is the point? So that's where I've gotten to.
Yeah, that's a very, very common thing that everyone who meditates has that. There are some people that have such intrusive thoughts that it's hard to break that cycle. Sometimes using some type of mantra, even if it's a prayer mantra that you're repeating over and over again, it kind of drowns out those thoughts. So that would be my only suggestion, is try and think about a short phrase that you want to use, that you kind of just repeat to yourself over and over again, because it does kind of quiet those other thoughts. So give it a shot.
We say the rosary after the 9 o'clock mass here. You're welcome to come.
That's awesome.
All right.
But the breath work too, when you lose your thoughts, is
Oh, yeah.
focus on the breath.
Yeah.
Just in the breathing.
Yeah.
And through the yoga practice, that's
Yeah.
been what I've learned. But I want to start the gratitude. Again, we put like, we pick a word for the year.
Right.
And when we would put little notes in a jar, and I pulled out some from 2013, a few years ago. It was the greatest thing, like things you were grateful for, and it was like, it was really
That's fantastic.
inspiring.
That's
It
awesome.
was a fun thing to do.
That's a cool idea.
Just pick your one word that you want, your mantra.
Yeah, yeah, oh, that's really cool, awesome.
I was thinking just being with nature. I love it, and I just need to go out more. And our backyard is beautiful, and just not just look at it always from the inside, and then get on with it, but really go out and just stand there and, just enjoy the view outside.
Yep.
So, remember to do that, like the little things that you were saying, rainbow, or just sometimes you forget to look at the.
Yeah, I have a back porch, and we've got a bunch of trees that are further out, but just watching the trees change over time is just.
And the birds,
Yeah.
and it's very beautiful.
Yeah, you kind of think about that. So that's
And
awesome.
sometimes you take it, a lot of times you take it for granted, so it's
Yeah.
important to look, go
Yeah.
out there. and-
Fresh eyes,
Yeah.
absolutely.
Probably breath work.
All right, switch over to the other side. Who wants to go over here? That way. Yes, ma'am.
Okay.
All right.
A couple of things. The gentleman over there was asking about the rosary and distraction. What I always do is on YouTube, it's rosary and song, and it's beautiful meditation, and I'll have like Monday, rosary and song, Tuesday, and they sing the rosary, and they have pictures, and they have the words up, and it's very meditation and very relaxing. I'll have it on in the morning or when I'm making coffee, and it's really keeps you focused. And then for me, since COVID hit, I work at home still, and my husband works at home still, and he hates it, I like it, but I'm on the computer literally all day and on Teams and my stress reliever is going out in the yard, running out in the yard, going around with the dog, looking at our trees, looking at things, and it totally de-stresses me, just walking around, looking and everything's blooming now, touching the flowers, things growing, and that's my de-stressor. But I'm gonna start this breathing work with Wim Hof and the YouTube, and Carolyn was telling me she's listened to it and how great it is.
Oh, great, awesome.
That's my this week I'm gonna do.
Excellent. All
So,
right.
I'm gonna go out and walk more. When I get out, then I don't think of things, I just get out and I enjoy what's around me and not think about other things.
That's perfect. That's what you should be doing.
I guess I'm an outlier, because I'm gonna strengthen my tribe.
All right, that's great.
I lived in Phoenix for 15 years, and now I've been here 20 years, so it's a lot of old friends. I should get stronger.
Yeah, awesome, that's great. No, I think that's really important. A group of my guy friends just started doing this the last couple of months. We set a date on the calendar, first Thursday of the month, we go out and we have dinner together. And that's just, whoever can make it, there's 7 of us, maybe it's just 3 of us one week, that's okay. So, doing that regularly.
I'm gonna wait for Chip to call me. You're all, the guys are invited. Very generous.
I like it, I like it.
I'm actually gonna set up ballroom dancing every day.
I'm good at that.
All right, this table.
I like Barb's idea of the word, the gratitude, putting something back in the jar.
That's great.
Small.
Writing down in a gratitude journal. Once it's down,
Yeah.
kind of, it's more concrete, it's more relevant.
Right. Yeah, for people that have racing thoughts, actually, it just reminded me of something, is that sometimes just writing down your thoughts, especially if you have that kind of constant cycling in your mind that some people have, just take the time to just literally on a piece of paper or in a journal, just write down whatever's in your mind. It's amazing how just putting it down on a piece of paper will kind of get it out of your head onto the paper, and it then is not as intrusive. So that's one of the recommendations for people that can't stop thinking about something, is just write down those thoughts. And then the next day you get the opportunity to kind of continue to do that, and then it becomes less intrusive over time. Yes, ma'am?
I just wanted to say I used to worry about things I couldn't change, things that I was not in control of. And I was finding myself really obsessing on them. It was always invading my thoughts. And I did start writing it down. And I put it in a beautiful jar that was given to me as a gift. And I put it someplace where I walked past many times a day. And then I would always touch it and say, Lord, into your hands. You know, so I used it as a prayer form. And over time, you can teach yourself not to obsess, especially if you're letting it turn over to somebody else. So.
Awesome. All right. It's just about 8:30. I don't want to keep people here past that unless you want to keep going. Any final questions or thoughts or things people want to say? Feedback? Yes.
Is this going to be video? Maggie got it. Is it going to be on YouTube then, or what?
Well, all I know is that I recorded it. I will let him finish with any final things, and then I'll say a few things. I'll give you the information you're looking for. Anything else?
Thank you.
Okay, thank you. Thank you very much on behalf of all of us. So I introduced myself earlier, Maggie McCarty. I'm on the Adult Faith Formation Committee for St. Francis of Assisi, and of course we offer many of our things to pastorate. And I wanted to mention that, of course, we're going to be here next week. So this is 1 week out of a 3-week workshop. So I hope that we'll see you again next week. It'll be new handouts, new topics, continuing on this really excellent topics that we've been talking about in terms of the 4 pillars of health. The second thing is that I wanted to mention, I saw it through the video camera, this cross. This is the San Damiano cross. And we are actually at the parish between masses next week. So at 10 o'clock on Sunday, right here at St. Francis, there's going to be a special presentation as part of the Adult Faith Formation Committee on the San Damiano cross. It's chock full of imagery, and the person that's giving it, Ray Glennon, his wife is sitting right in front of me. Ray is a Third Order Franciscan and is really quite an expert in terms of Franciscan spirituality and Franciscan imagery as well. So Ray will be doing that between masses this weekend. Our masses at St. Francis are at 9 o'clock, which I never go to. The 9 o'clock mass, and then at 11, so that this presentation will be at 10, a short presentation between masses, and then of course then we invite you to join us here next Wednesday, same time, same place, same excellent presenter. So on behalf, and the last thing I wanted to say is that we have been recording. It's not a professional recording by any stretch of the imagination, and in fact sometimes you hear the voice, you'll hear the voice talking, but you won't see anybody there because he didn't stand right here. I think that we got a lot of the sound and a lot of your questions and your interactions. And so please tell your friends if they want to listen in as to what happened this week and join us next week, they're more than welcome to do that. So on behalf of that and anything else, I just want to say thank you again. I'm so glad you're here. Please, and
work on your homework.
No, we don't.